Now, I'll show you some cases that we can do using some special products. Like this is a very difficult case. Very difficult case. You have to reduce the bone. It's not because of an All-on-4. You reduce the bone not because of All-on-4. All-on-4 is a surgical technique. You don't reduce bone because of All-on-4. You reduce bone in order to avoid an aesthetic problem. So this is the kind of thing we do. How did we do that? Reduce 9 millimeters of bone. You obviously in the sinus. All the implants are placed. Well, we use zygoma. No, we did not. We just used short implants, but we placed all the implants on the nasal cavity. But these implants have to be conical shape in order to penetrate without spinning. This is immediate load. That case, normally in the old days, we had to graft, then remove the bone, then place the implants. Hybrids, typical solution here. Look, the implant comes on the perfectly occlusal on the premolar, or also another perfect place, which is the palatal plate of the bridge. What is this? It's a zygoma, because we know exactly where to place them. There's no more things of, coming too palatal or less palatal. It's up to the surgeon to decide where the head will be. And with special products, we can do cases like this. Syndromes that we have, for instance, a 16-year-old boy without any bone in the back, mandible and maxilla. You can see how thin it is. And then, immediate load. What did we do here? Well, we used zygomas in the back, but we used short 3.3 implants. This is impossible if you do not have access to these products. And we can do cases like this with these implants, the zygoma implants. And we can do cases like this where the mandible is less than 6 millimeters in height and less than 3.5 millimeters in thickness. With the cantilever of 5 teeth. We implants of 3.3 by 5. And we can do these cases. Loss of maxillas. Maxillectomy is due to cancer. You see? The implants are placed. These are special zygoma implants. Allow us to, these are articulated zygoma implants, that we can do these cases because a patient without a maxilla, there's no way we know where the implant is, where it's coming out. And then we place this, and we use the rim of the eye. But this patient has an eye. We use the rim of the eye with these implants. And then we end up like this, and then we push on the soft tissue. We work with the plastic surgeon, and from this to this,